Hello, everybody, and thank you so much for joining me on this evening regarding this webinar topic, The Mysteries of the Thyroid, Natural Ways to Deal with Hypothyroidism. Hypothyroidism and just talk about thyroid is one of my favorite topics. You know, it's unfortunately very, very common, but fortunately, there is a lot that can be done about it that can make people feel better once they realize that they have hypothyroidism and the pattern of hypothyroidism that they have. And we'll definitely be talking more about that today. Anyway, let me start by introducing myself. I'm Dr. Hirani. I did my residency and board certification in family practice in Michigan. After that, I practiced for some time in a traditional family practice office and realized there was a lot of things I couldn't treat within the boundaries of mainstream medicine. Anyway, that's when I started exploring more alternative forms, and here I am today. So, my approach is I try to combine the best of both worlds. I use traditional medicine when absolutely necessary. My preference is to work with natural or functional medicine, where we really try to look for the root cause, see what's going on in the body, and bring the body under better balance. So, let's get started on this topic with the very basics. Where is the thyroid gland and what is it? So, as you can see on the picture there, the thyroid gland is a small walnut sized gland which sits right in the middle of our neck and secretes the thyroid hormones, which are necessary for the energy production and regulation of every single cell in our body. The thyroid hormone is responsible for controlling the chemistry of every organ in our body. So once it's released from the gland, it goes into the cells and knocks on all the cell doors, telling them to do their job appropriately or efficiently. Thyroid hormone speaks to the brain cell, saying, hey, brain cell, do your job. Heart cell, do your job. Bone cell, do your job. Hair cell, do your job, etc., etc. Okay. So if the thyroid hormone is not turning the motor on of our cells, then those cells become less efficient and everything slows down. So as seen on the slide, hi, I'm your thyroid gland. I'm small, but I affect your life, which is literally true. Okay. So that's why the symptoms, the classical symptoms of hypothyroidism are those due to the slowing down of the cells in our body or slowed metabolism. Hypothyroidism many times has also been kind of known as the great masquerader because it can mimic or masquerade or feel like so many different conditions and symptoms in the body. Okay. Classic symptoms are listed on the slide. You feel tired, you just feel depressed, brain fog, feel very cold, gain weight very easily because of the slowed metabolism, hair loss, headaches, constipation, menstrual irregularities in women, and even high cholesterol can be a symptom of hypothyroidism because the thyroid helps to clear out excess cholesterol. And again, if it's slow and not doing its job, you can't clear some of that excess out. And the list actually goes on. There can be up to 50 different symptoms of hypothyroidism, but I've listed some of the most common ones on this slide. You can see kind of a little cartoon there on the right, the seven dwarfs of thyroid disease. Very, very, how familiar does that look to some of you that are dealing with this? So let's look at some statistics. Unfortunately, hypothyroidism is a highly underdiagnosed condition. About 20 million Americans suffer from improper thyroid function. Up to 60% of those that have thyroid disease don't even know that they have it. Women are 5 to 8 times more likely than men to develop thyroid issues. And 80% of hypothyroid conditions in the United States are known to be due to autoimmune or Hashimoto's hypothyroidism. And we'll talk more about that a little bit later in this presentation. It's estimated that 1/3 of hypothyroid patients actually have normal blood test results. And almost 20% of patients that were hospitalized for severe depression were actually found to have Hashimoto's, which is the autoimmune hypothyroidism. 52% of patients with untreatable major depression actually have hypothyroidism. Now, there is another condition called hyperthyroidism, which is too much thyroid hormone in the body. And the autoimmune version of that is called Graves' disease. We're seeing more and more of that nowadays than we have in the past. And that is also, a form of thyroid disease. For the purpose of today's talk, I'm going to focus on low thyroid or hypothyroidism. So, sounds to me like you are just a little bit depressed, even though everything is screaming low thyroid. Richard James, who authored the book Thyroid Power, he put this quote in there, which I absolutely love. He says, although extremely common, low thyroid is largely an unsuspected illness. Even when suspected, it is frequently undiagnosed. When it is diagnosed, it often goes untreated. And when it is treated, it is seldom treated properly. Very, very, very true in my experience. So, why is hypothyroidism a medical dilemma? Let's talk about that a little bit. As mentioned, it's considered the great masquerader. Many times, improper thyroid function is often misdiagnosed as depression, PMS, poor diet, many other conditions. It's commonly treated as depression because of the large number of vague symptoms. Even, the condition of depression has a lot of vague symptoms, just like hypothyroidism does. So you realize you're not feeling well, you're tired, you're gaining weight without any reason, you're cold, you're achy, you're constipated, brain fog, losing hair, and all these things go on and on and on. You think you have hypothyroidism, right? Because you've listened to my talk today. And you choose to get blood tests done, and they're normal. You certainly didn't expect that. You're clearly not feeling well. So what is going on? Right? So you ask yourself, well, why do I still have thyroid symptoms when my lab tests are normal? And that actually is the name of a book as well, which I highly recommend reading if you're interested in more information. Well, one of the reasons this is a medical dilemma is because TSH is considered the main blood marker used to diagnose hypothyroidism. And how many of you have gone to your, doctors and gotten tested for hypothyroidism, and that's the only marker that's tested, and you've been told that it's normal? Okay. The problem is multiple authorities, including the NIH, have proven that TSH testing is not a very reliable test. Yet, that's what we rely on to diagnose hypothyroidism. TSH is affected by way too many factors to be completely reliable. And this has been shown in various studies. Again, like I said, including the NIH, that proved its unreliability in a study done in 2018, done by the Department of Endocrinology in an outpatient clinic. So the study is in this particular journal is listed on the title over there called Does TSH Reliably Detect Hypothyroid Patients? So, this study took people who had hypothyroidism symptoms and they checked their TSH using two different lab methodologies. One of them is called immunoassay, and the other one was called mass spectrometry. The immunoassay method showed normal TSH, whereas the mass spectrometry method showed an abnormal TSH. Those patients that had those low thyroid symptoms, which showed an abnormal TSH via that method of testing, were given thyroid medication and their symptoms improved. So, therefore, it's concluded that the mass spectrometry testing was a much more accurate testing method. The problem is that this testing method is only available in research labs. None of the major labs that you hear about and that you go to, Quest, LabCorp, Sunrise, you name it, does this particular type of testing. Why? Because this testing is complex and unsuitable for high output laboratory analysis, quote unquote. So therefore, it's clinically unavailable to the general public. Okay. So basically, we're relying on the immunoassay testing, which is the most commonly done, and just as demonstrated in this study and others, it is not very accurate. So thyroid function is just too complicated to rely on a single test like TSH. You're made to believe that it's a very simple, okay, TSH is abnormal, take thyroid medication, adjust it either high or low, depending on the TSH. And that can work well for many people. Then there's a lot of people it doesn't work well for. Okay. And they realize that they've been, treated for their abnormal TSH and maybe they feel a little bit better, but not as better as they were expecting. Really don't feel better at all, right? And you're wondering, well, why? What's going on? And those are a lot of the patients that I see, right? Coming to me going, well, I don't understand. I'm treated. My TSH looks normal, but I'm still having all these low thyroid symptoms and not feeling well. In fact, TSH is not even a thyroid hormone. It's actually made by the pituitary gland in our brain, and it acts on the thyroid. So that's why TSH only tells a part of the story. Okay. To get the complete story, you really need to do much more comprehensive blood testing, which includes other thyroid markers such as free T4, free T3, reverse T3, and thyroid antibodies. And actually, the American Thyroid Association made a statement saying that yes, you should do comprehensive thyroid testing. This is not something that I or other functional medicine doctors are making up. So, another journal called A Clinical Debate Subclinical Hypothyroidism. This study was done in 2021, stated that the TSH reference range is very wide. You know, the reference range that you see on the lab test can be anywhere between zero point 0.3 and 5.0. That's considered the normal range. But TSH values differ according to your age and multiple other factors. So, for example, the normal TSH range in Texas is different from the normal TSH range in here in Virginia. So you might, your TSH may look normal here and you're told you're fine. And then, you go to Texas and you get it done there and you may look abnormal and you're diagnosed with hypothyroidism. Okay. I could go on and on about, TSH ranges and something called the bell curve and how they come up with these normal ranges, but I don't want to take too much of your time with all that talk. But normal ranges are not always, well, they might be normal ranges, but they're not always accurate or optimal. Okay. So data suggests that the current reference limits of TSH don't actually reflect the true normal range. Okay. The true normal range is likely much narrower, and many reports have suggested that range should be somewhere between zero point 0.4 and 2.5. Okay. And this is again supported by various studies. Now, Hypothyroidism really is one of those things where you do have to look at subjective and objective. You have to look at the symptoms and you have to look at the numbers to really make that determination if you've got hypothyroidism or not. So, for example, if your lab work might be abnormal, but you feel great and you may not really need to be treated. Okay. Or vice versa, which is the more common approach that we see where all your thyroid numbers look normal or your TSH specifically looks normal and you have all the symptoms in the book, and you're not treated for it, right? So good news, your test indicates that you're in the normal range. So I want to take a moment here to just, talk about a patient that I had. I saw her many years ago. She's still a patient of mine. It's probably been 15 or more years. But very interesting story. When she first came in to see me, she saw me, when I was first kind of new to a lot of this stuff, functional medicine, and she came in to see me because she would develop fluid around her heart almost every month. And she would have to go to the hospital almost every month to get that fluid drained. And, she came and see me, what can I do about this? And I didn't really know much about it. And I said, look, I really don't know. I'm not an expert at this. I'm not sure what we can do, but why don't we just follow the basic functional approach, right? And kind of look at your basic hormones, look at your gut, look at other things and just see how you're doing. And so what I found that she was one of those people that the TSH was normal, but very, very borderline elevated. Okay. So she was, I think, at about a 4.2 or something like that. So, she had all the classical symptoms. So I said, why don't we treat you for the thyroid? And we did. And not only did she feel a lot better, but never again, and I don't think ever in these 15 years still that I've been seeing her, has she ever gone back to the hospital to get the fluid drained from her heart. Okay. So little did we realize that, yes, hypothyroidism was playing a role with that particular symptom with her. Okay. So again, like I said, the thyroid affects everything in the body, and sometimes you just don't know where it is contributing to certain things or not. Her cardiologist actually wrote a letter back to me, stating that, wow, I'm surprised. This. I said, guess what? I'm surprised too. But now, of course, it's been some time, and I've seen more and more stories like that where we can attribute so many things to an imbalanced thyroid hormone. Okay, so let's understand this thyroid physiology a little bit because it really helps us to understand how the thyroid works and what might be going on in our own bodies. So as you see at the top over there, you see the pituitary gland in the brain. That's what produces what I mentioned before, the TSH, which most of you may be familiar with. TSH stands for thyroid stimulating hormone. So what does it do? It stimulates the thyroid gland in our neck to produce thyroid hormone. Okay. You can see down there the bulk of the thyroid hormone, about 80% of hormone that's produced from the gland is in the form of T4. The problem with T4 is that it's metabolically inactive. In other words, it doesn't really do anything. It does need to be activated to its active form, which is T3, as you can see there. T3 is the one that's activated and actually goes and delivers the energy supply and cellular signals to all the cells in our body, telling them to do their job, as I mentioned earlier. Okay. So, 80% of the T4 converts into this activated T3, or is it supposed to? And about 20% of that T4 converts into something called reverse T3, known as the anti-thyroid, or what I call, quote unquote, the bad thyroid. What does reverse T3 do? It actually blocks our cells so thyroid can't get in. Okay, so let's put an analogy to this whole thing. So, for example, if you think of T4 as the ignition key to your car, right? So you've got your key, you go sit in your car. If you just sit there with the key, are you going to get anywhere? No, you've got to turn the car on, right? You have to turn the key, at least for the older cars. You got to turn the key on, and then your car will move and it'll get you somewhere. Similarly, if you've got plenty of T4, but you're not turning the motor of your cells on, they're not going to work. Okay. That's why you can see, on a blood test, your TSH may be normal, your T4 may be normal, but your T3 may be low, right? That means you've got poor activation, and that's still going to give you symptoms of hypothyroidism. Reverse T3 is as if you've got the key, you're sitting in your car, and me or somebody else comes and takes the key away from you. Okay. So same thing. You're sitting in your car, reverse T3, it's blocking your ability to even drive or get anywhere. In a cellular role, your cells are being blocked, T3 is not getting in. And again, those communication signals are not occurring, giving you symptoms of hypothyroidism. So again, in that case, you may have normal TSH, normal T4, normal T3, but maybe you've got elevated reverse T3, blocking your cells, still giving you symptoms of hypothyroidism. Okay. But we also have something known as a pituitary pattern. So the purpose of the TSH, or the pituitary in the brain, is that it acts like a sensor or a signal. All right. It goes, how much thyroid hormone do I have in the body? If it detects low levels, like in hypothyroidism, then it starts to overstimulate the thyroid gland. It says, come on, thyroid gland, make more, because we don't have enough. And that's why with low thyroid function or hypothyroidism or low T4, you're typically going to see a high TSH. Think of it like the volume button. So high TSH means low thyroid. Okay. So that's kind of more of the conventional finding where, you've got the hypothyroid symptoms, you get your TSH done, it's abnormal, you get treated for thyroid hormone, and you might feel better. But again, if you've got the key, right, but you're not turning it on, if you've got low T3 or a high reverse T3, you're still not going to necessarily feel better. Okay. So very important to test all of those. And then, the other markers that are not on here is the thyroid antibodies. You may have all of these markers on this slide are normal, but you may have elevated thyroid antibodies. And those thyroid antibodies over time attack your thyroid gland, damage the thyroid gland, and attack your actual thyroid hormone, so that even though you're producing thyroid hormone, they're being attacked on their way to the cell. You're not getting adequate thyroid hormone into the cell, again, causing this insufficiency or inefficiency of cellular function, which, as we discussed earlier, causes, you get those low thyroid symptoms. Okay. So why is it important, aside from, identifying that you've got secondary or tertiary hypothyroidism by measuring these other markers, but also based on which other markers are abnormal, you can actually be able to see what's causing it. Okay. Um, so as you can see on the slide over here, for example, if you have low T4 production, okay, those factors that inhibit proper production of thyroid hormones, as you can see on the right side, may attribute to that, right? Stress, infections, trauma, fluoride, too much fluoride, toxins like mercury, cadmium, lead. Okay. And by doing a detailed history and questionnaire, we might be able to figure out if one of those is part of the issue. And if it is, then we want to look for that and we want to treat it so that we can get your own thyroid gland to produce thyroid hormone the way it's supposed to. Okay. Suppose you have normal T4, but you have low T3, you're not activating it. Some common reasons for that is deficiency in certain minerals like selenium, zinc, and iodine. Okay. And remember, T3 and reverse T3, they come as opposite to each other. They're competing for the same receptor sites. So whoever is more will win. If you have a lot more T3, great, you're going to get great activity in your cells. If you have a lot more reverse T3, you're going to block activity in your cells. Okay. So if you have too much reverse T3 on the left side of the slide there, again, you can see all the different factors that influence that. Okay. On the bottom right, suppose everything is normal. There is a little bit of a well, I wouldn't say rare, but not as common condition known as thyroid hormone resistance, where you've got enough thyroid hormone, but your cells are resistant to the effects of thyroid hormone. It's just not able to do its job, even though it's knocking on that door saying, hey, do your job, cell. But the cell's not able to listen to it because it's resistant to its effect. Okay, something like insulin resistance. So, low vitamin A, lack of exercise, zinc deficiency can lead to thyroid hormone resistance. And that's why I always test zinc levels and, many of these other markers in your blood work as well. Okay. So, very, very helpful to know the pattern of hypothyroidism in order to correct that pattern. Right. So, worldwide, the most common cause of hypothyroidism is iodine deficiency. Iodine is a very important mineral needed for the production of thyroid hormone. In fact, T4 means four iodine molecules. And then when one of those iodine molecules drops off, converting into T3, that's when it becomes activated. Okay, so that it can get into the cell and deliver the signal. However, the most common cause of hypothyroidism in the United States is actually autoimmune or Hashimoto's hypothyroidism. About 80, and some reports say 90% of people that have hypothyroidism over here, it's actually due to an autoimmune reason. And we'll talk more about that in a moment. Other causes of hypothyroidism include certain medications, chemotherapy, radiotherapy as well. If you're getting x-rays and things like that, I always recommend trying to get, requesting them. And you can request that if they haven't already given it to you, some sort of a neck shield to protect your thyroid gland. Pregnancy can also cause hypothyroidism. In fact, pregnancy, delivery, these are common times in a woman's life when, she may develop hypothyroidism. Stress, sure. Chronic long-term stress or adrenal fatigue can lead to hypothyroidism, chronic infections, particularly Epstein-Barr virus, H. pylori, certain types of bacteria. And it's pretty because if we do identify these and we're able to get rid of them, a lot of times people will find their thyroid function improves. Other hormone changes, for example, too much estrogen in the body is a very common cause. Too high cortisol levels are again common causes, which can also lead to hypothyroidism. And then certain nutrient deficiencies, as demonstrated in the previous slide. As I just mentioned, stress can play a role. Just like that the pituitary gland in the brain doesn't only produce TSH, it actually produces a lot of other, hormones as well, which are involved in the signaling and functioning of other endocrine hormones, including our adrenal glands. This looks like a very complicated slide. Basically, it's parallel. You see on the left side, you see HPA axis. On the other side, you see HPT axis. That's hypothalamic pituitary thyroid, hypothalamic pituitary adrenal. And you can see the different markers on both sides can either stimulate or inhibit each other, based on how much stress you're having. So usually with high stress, you produce higher levels of cortisol, and then those high cortisol can block the production of the TSH itself, or it can even block the production of thyroid hormone. It can also prevent the conversion of T4 to T3, and it can increase your reverse T3. So it actually plays a role in many different aspects. Okay. All right, let's talk a little bit about Hashimoto's. As mentioned earlier, this is the most common cause of hypothyroidism. What does autoimmune mean? That means when your body loses sense of sort of self and it starts to attack some of its own healthy thyroid tissue. Okay. Why does this happen? Usually it happens because our immune system has gotten confused somewhere along the way and it starts to over attack either because of too much toxins in the body, certain chronic infections that have been there for a long time, chronic allergies. Our immune system sees these things as enemies and it keeps on attacking and attacking and attacking. Eventually, just becomes overreactive. Okay. And start to attack our thyroid gland, or depending on what you're predisposed to genetically, or again, a whole set of other biochemistry in your body, which organ it's going to attack is just very variable. If it attacks your joints, you might have rheumatoid arthritis. If it attacks, your gut, you may have ulcerative colitis, different things, et cetera, et cetera. But in this case over here, we're talking about, the thyroid dysfunction. So understanding, therefore, what's putting your immunity into overdrive is one of the big keys to really treating and managing hypothyroidism. The main cause of an overactive immune system is inflammation caused by infections, injuries, overload of toxins, a diet lacking in antioxidants. Our body keeps producing waste products constantly, cellular waste and other reasons, which release a lot of free radicals. And antioxidants help to neutralize these damaging free radicals. Okay. So, very important to get those antioxidants in. Intestinal permeability, something commonly known as leaky gut, is very commonly involved. I do another webinar where I talk about autoimmunity. So stay tuned for that particular webinar where we get a lot more into this. But anyway, something that's got, you may have tested all of your blood work and you find that everything's normal, except you have these elevated thyroid antibodies. That causes a gradual immune destruction of the thyroid gland over time. Most research shows that it takes about 10 years of thyroid, antibody immune attack before your actual thyroid gland gets destroyed and can't do its, job of producing thyroid hormone anymore. In traditional medicine, you basically just wait. You just monitor every year. You might go in, check those antibodies, maybe, maybe not, and you just wait. And then finally, when you see an abnormal TSH or thyroid, hormone destruction, that's when you start treating. That's not the approach that I recommend, right? If you know you've got Hashimoto's, if you know you've got elevated thyroid antibodies, let's try to work on the immune system, calm those things down, and hopefully prevent you from developing hypothyroidism altogether. And also, by the way, people that have thyroid antibodies but normal thyroid function, they may still have symptoms of hypothyroidism as demonstrated earlier. Um, symptoms are usually present long before that diagnosis is made. So definitely worthwhile knowing if this is something that's going on. Okay. So there is something called molecular mimicry, as you can see on the slide. It says, did you know that the molecular composition of the thyroid tissue is very similar to gluten? So about 80 to 90% of people that have Hashimoto's hypothyroidism do incidentally also have gluten intolerance. Why? Because of this concept known as molecular mimicry. So as you see on the right side over there, you see the molecule, the structural molecule of gluten, you see the structural molecule of casein, and then you see that, which is milk or dairy, and then you see the structural molecule of the thyroid tissue. You can see how the immune system can get confused, right? Gluten and the thyroid tissue, gosh, they look so similar to each other. One's got two diamonds, I guess, whatever you want to call it. And then the other one's got like a triangle and a diamond, right? Very, very similar. So our antibodies, when they keep seeing gluten, they think that that's the thyroid hormone, right? And so they attack. So every time you eat gluten, that attack increases, and therefore it's going to increase attack to the thyroid tissue as well. So again, a lot of people with Hashimoto's will find when they cut out gluten or reduce gluten, the thyroid antibodies get better and their thyroid symptoms get better as well. So worthwhile identifying if you have gluten intolerance or not. Right. So, how do we make the diagnosis of hypothyroidism? By the way, just so you all know, you will be getting a recording of this webinar, within the next week or so. Please stay tuned. I know I'm talking somewhat faster because I want to, we have a lot to get through over here. But I really, really want you to have this information and be able to go back at your own convenience and time and be able to digest it. So you will be getting this webinar. Please feel free to, go back and listen to at your own convenience later on. All right. So, how do we diagnose hypothyroidism? Well, as I mentioned earlier, the subjective and the objective both really, really do matter. So, I usually have my patients do questionnaires, and if you're feeling at least 80% or more of the hypothyroidism section, and you have a lot of those symptoms, I definitely want to know, do you have hypothyroidism or not? So, doing the blood work is going to again be very important, which is the second bullet point there, right? Do the laboratory test. Again, you want to do thorough, complete testing. Sometimes it's still a little bit confusing. And so it can be helpful to do body temperature charting. And I also want people to realize that low cortisol or adrenal fatigue symptoms are very similar to low thyroid symptoms. So, you ask yourself that question, why do I still have hypothyroid symptoms when my lab results are normal? Well, it may be because you actually don't have hypothyroidism. You actually have adrenal dysfunction or adrenal fatigue. And that's what's causing your symptoms. Okay. There's just a very, very high overlap between the two. In fact, it's almost unlikely to have one without the other. Okay, so very, very high overlap. And usually people will develop, adrenal issues before they develop thyroid issues. Not always the case. Sometimes I absolutely see the opposite happening, and you got to fix the thyroid in order to fix the adrenals. But the majority of the time, you got to fix the adrenals to fix the thyroid. In fact, it's very important to do that. All right, so this is an example of body temperature charting. The temperature chart that you see on the top is due to thyroid charting, and the one you see at the bottom is adrenal temperature charting. So, generally speaking, in both conditions, we tend to see lower body temperature, which is indicative of that low metabolism, right? If your body temperature is low, you tend to have a lower metabolism, much harder to burn fat and, get energy because we're supposed to burn fat and create energy out of that fat. So our body temperature is typically, as you can see over there, about 97.8. So on the top slide there, you can see in that particular person, they've got low body temperature. Points A and B is low body temperature. Right after point A is when they start thyroid medication. You can see the body temperature getting better, and then perhaps they needed to increase their dosage, and now it actually looks normal. And as they increase it, that body temperature gets higher and higher. Okay. Now, in this case, it's a very consistent low or consistent high, as you can see there. The bottom chart, which is the adrenal insufficiency chart, in an adrenal pattern, you see a lot of up, down, up, down, up, down. In other words, your temperature can be so variable from day to day. However, in general, with adrenal dysfunction, it tends to run below that 98.6 mark. And then as you treat the adrenals, it gets above the 98.6 mark. So some people really, really like to, chart their body temperature and get a better understanding of how they're responding to their treatment, whatever that treatment might be, whether it's a medication, whether it's a supplement, lifestyle changes, or whatever. Because the reality is most people will feel better when they get that body temperature into a good range. And also kind of knowing, is this more adrenal or more thyroid? Again, if you see that day-to-day fluctuation, it's more of an adrenal issue. If you see more of the consistency, it's thyroid. All right. So remember we talked all about, how TSH can be inaccurate, especially with the testing methods we have, the commercial testing methods we have. That's, the good testing method, which is only available to research medicine, is not what most of us are doing, or any of us are doing probably. Anyway, there are certain ways we can try to make whatever testing we have of the TSH a little bit more accurate, and try to, every time you test your TSH and thyroid hormone, be as consistent as possible. And all my patients, when I give lab orders for the thyroid, you'll see these instructions on all of your TSH lab orders. So according to Dr. Weston Childs, who's one of the experts and really, really studied this in a lot of detail, he mentioned all of these bullet points over there. We already talked about it's very important to get the full thyroid lab panel. Ideally, you want to try to get those labs done at 8 a.m. Okay, that's when we see the most accurate TSH. You do want to check your thyroid labs in a fasting state. I know you're typically told, hey, you don't have to fast, but good idea to fast. Again, you want to maintain that accuracy. Check your labs before taking any thyroid medication that day. For women, avoid testing your thyroid on days 10 to 20 of your menstrual cycle. Remember, we said the thyroid affects body temperature, and so does ovulation, so does estrogen, progesterone, et cetera, right? So, um, So day 10 to 20 is when, we can see that kind of messing with it a little bit. Definitely avoid taking biotin about 2 to 3 days prior to your thyroid lab test if you are taking that as a supplement. And also, I don't recommend rechecking your lab test more frequently than every 6 weeks. You do need to give a chance to whatever you're doing to kind of settle, if you will, in the body. Okay. And sometimes we may need to do that until we get things right where we're testing every 6 weeks. Once we get it just right, then we can, go further apart with the testing. Also, by the way, please feel free to, ask any questions you have in the chat box as we go along. I know sometimes questions come up and then you forget at the end. So please feel free to ask any questions you have in the chat box as we go here, and I will try to address and answer all of those in the end. Okay. All right. So, I think the slide is maybe, well, I don't know if it's out meant to be here, if I meant to put it in earlier, but we talked about the concept of normal versus optimal, right? So again, you can see the normal zone there, but really when we're looking at blood tests, we want to look at that optimal zone. And I always, not just for thyroid, but for a lot of other markers in the body or in the blood that we look at, we look for the optimal zone. The optimal zone is what they found generally the range at which a person virtually has no symptoms. Okay. So, for example, with TSH, that range of about, zero point 0.5 to a 2.5, most people, if they're in that range, has virtually been found to be completely asymptomatic. Okay. But the normal range, like we said, about zero point 0.5 to 4.5. So, if you're like a 3 or 4, a lot of people could still get symptoms. And this is based on a scientific analytic concept called the Bell's curve, bell curve. So the optimal zone is looking at the middle third of that bell curve. Right. So other laboratory testing we can do. So remember, our body's all connected. These hormones don't act independently of each other, right? So if one of them is off, it could be causing others to go off. And if we're only focusing on trying to fix the thyroid in the background of other hormones being off balance, again, we may not feel as well as we should be. Okay. Um, So again, it's very important to look at all of these together. Other laboratory testing we can do is, check for the male and female hormones, adrenal hormones, which is cortisol, DHEA, look for other vitamin and mineral deficiencies. Remember, we talked about earlier iodide, selenium, zinc, these various nutrients playing a role with our thyroid health, right? So, or too much metals like mercury fluoride, again, they block our thyroid. So, worthwhile looking at all of those, other chemicals, other heavy metals, certain drugs you may be taking, could make you prone to hypothyroidism. So if possible, you want to try to switch out to another medication if you're on a medication that can, hurt the thyroid. Chronic infections, as we've talked about before, you can look for those and treat those. And food intolerances, I've already talked about gluten as being one of the big ones. And does everybody need to do every test? No. It is very important to kind of, that's where we really, really talk about that history. And see what are your most likely causes and then try to identify what you need to do. Do some people need to do all of the tests to try to figure it out? Yeah, some do. It's not always easy to figure it out, but the closer we get to figuring it out, the better we can heal and treat. Treat hypothyroidism. There's many different ways. We of course have the conventional synthetic hormones, your classical synthroid, levothyroxine, levothyroid, etc. Okay, and well, for many people, that works best for those people that have what's known as a true primary hypothyroidism. Right, those are the people that have an elevated TSH and perhaps a low T4, where you're not producing thyroid hormone. So those can work. That can work well. Um, for those people that are not converting T4 to T3, guess what? We might give you Synthroid or T4 and you're not feeling better, right? Because remember what we said, T4 is inactive. It's the key. You got to turn the key on. So those people may also need T3. So you have to take two thyroid medications, T4 and T3. Another preparation you can use is the natural thyroid preparations, which is known as natural desiccated thyroid. The two most common ones out there are Armour thyroid. Armour thyroid has been out for over 100 years. Very, very old, tried and tested medication. Of course, its formulation changed about 20 years ago, so it doesn't work as well as it used to, in my opinion, but it's still available. And then the other one we have is the NP thyroid, just a different brand. But what these are the thyroid glandular extracts of a pig. They're not exactly like our own thyroid hormone, but they're very similar to it in that it contains T3, T4, and a little bit of T1, T2, which is what our own thyroid hormone looks like. So it's a lot more of a holistic thyroid hormone replacement. And many, many people find that they feel much better and do much better with the natural desiccated thyroid. The beauty with this medication is it's very safe, no adverse effects. The side effects are just those of, either taking too much or too little, right? Either causing hypo or hyperthyroidism. Whereas Synthroid and, some of the synthetic T4s and T3s have their kind of own independent side effects as well. For example, Synthroid, one of the side effects is hair loss. So sometimes people that are dealing with that, it's hard for them to tell if, the hair loss is from too little thyroid, too much thyroid, or from the Synthroid itself. Okay. So it's tricky sometimes. And experiment and see what works best for them. Some of this is going to be trial and error. Most people do much better on the natural desiccated thyroid. Sometimes people with Hashimoto's, though, may not do as well with that because it resembles your thyroid hormone too closely in nature, right? So your thyroid, your immune system is going, whoa, that's my thyroid, let's attack, right? So it might want to attack the natural preparation more than the synthetic. So that is something we need to watch out for. And that's where, again, if we track the antibodies, we can tell what's going on, right? If those antibodies go up, we may need to switch over. Um, we want to make sure we correct other vitamin and mineral deficiencies. Definitely diet, nutrition, exercise, lifestyle, managing stress. These things play a huge role in management of hypothyroidism. I cannot emphasize that enough. So one of the things we see, for example, people with hypothyroidism, a common symptom is weight gain, right? So when you're gaining weight, you're feeling sluggish and tired, what do? You start to eat less and you're restricting calories, and then you're feeling more tired, and then you're craving and you end up overeating, and the cycle goes on and on and on. Well, it's very important if you have hypothyroidism to get adequate calories. If you're not getting enough carbohydrates, the right kind of carbohydrates, and you're not getting enough calories, you're actually depleting your thyroid more, and you're never going to be able to correct this vicious cycle of metabolism. So you want to make sure you're getting adequate calories, adequate carbohydrates, fix the thyroid. Your dietary focus should be fixing the thyroid, and then you should find, as that gets corrected, the weight is dropping. Okay. That's just an example. Overexercise is another thing. If you're overexercising or exercising too much, you can also suppress your thyroid function. And so, how many of you have said, "Gosh, I'm undereating, overexercising, I'm still gaining weight, or it's not working," right? So, if you have hypothyroidism, we see that a lot. So, very important again to balance that. You want to definitely correct other hormone imbalances, and then you want to treat underlying infections, leaky gut, toxins, all that stuff that we spoke about earlier. There's some dietary guidelines on here. I'm not going to go through everything on this slide, but I do want to point out a couple of things with thyroid. You want to be careful with soy. I could probably just do a whole talk on soy. It's such a complicated food, but generally, if you've got hypothyroidism, I don't recommend overdoing soy in your diet. You want to limit it to no more than maybe a couple times a week. I'm not saying don't eat it, but a couple times a week. Really watch that because too much soy is estrogenic, which then can suppress thyroid function. Also, cruciferous vegetables. Okay, cruciferous vegetables are wonderful foods. I encourage everybody to get plenty of it every day. However, people with hypothyroidism, if they're eating too many raw cruciferous vegetables, you can actually suppress your thyroid function. So please eat them in a non-raw form. Um, and then iodine-rich foods, selenium-rich foods, you know, uh, protein, like I said, the right kinds of carbohydrates, very important, lots of vegetables. And then you do want to look into gluten and other food intolerances because if those are problems, of course, you want to reduce those or avoid those as well. And I kind of talked a little bit about exercise and sleep, but very important, for most people really to get a balanced exercise regimen, but especially with hypothyroidism. Okay. Make sure you're getting enough sleep. Sleep is our battery charger. So if you're not sleeping and you're not charging your battery, again, your metabolism is going to slow down and the thyroid gland is going to get sluggish, very hard, to help produce thyroid hormone. Prevention, alcoholism does tend to run in families. So if you know you have a risk of it, or if you know you've got thyroid antibodies, prevention is going to be equally important to try to prevent it altogether. So again, just some basic things or, some targeted things depending on your biochemical individuality. I listed, several nutritional supplements. I don't recommend going and getting all of these, but, maybe taking a good multivitamin with a lot of these. Caution with iodine. Iodine can be a double-edged sword. I've kind of talked about how wonderful it is and how necessary and important it is for good thyroid function. And I even talked about how iodine deficiency is the most common cause of hypothyroidism worldwide. But guess what? If you've got Hashimoto's, you have to be very cautious with iodine. If you are overdoing iodine or taking too much of it, you can actually worsen your thyroid function. So please don't take iodine unless recommended by your doctor and unless you've tested your levels and know for sure what your iodine levels actually look like. Okay. Um, but if you do have Hashimoto's and you have low iodine, you can take a little bit of it cautiously. But again, please work with your doctor on that. So yeah, like I said, thyroid hypothyroidism and the thyroid physiology itself is a lot more complicated than it's made out to be, but it is very treatable. There's just so much we can, try to understand and so much we can try to do about it. And because, as demonstrated, the thyroid gland affects literally every cell in our body, it's worthwhile getting the thyroid hormone optimized, right? Because that means you feel better all around. And plus, you can help prevent so many other conditions as well. So I hope that you were able to learn something from this talk. I hope that it was eye-opening. Um, Please feel free to ask any questions that you have. Just go ahead and type them in the chat box. I'll give you a few minutes to just kind of gather your thoughts and ask your questions, and then I will try to address all of them as we go here. Thank you so much. You've been an absolute wonderful audience, and I wish you good health and good luck with everything.